checked my chart and everything. I've gathered all my supplies and stuff. I've washed my hands and everything, so I'm gonna knock on my patient's door. Knock, knock, may I come in?
Yes.
Hi, my name is Jan. I'm gonna be your nurse for today. Can you tell me your name and date of birth, please?
Kimberly Turner, 7/22/62.
Okay, can I see your ID here? Oh, thank you, ma'am. I appreciate it. And what would you prefer, how would you prefer I address you today?
Well, my name is Kimberly, but everybody calls me Kim.
Okay. Well, Kim, I'm going to be with you until 7 o'clock tonight. Right now, I'm getting ready to do some checks on you. I'm going to be assessing your skin, your hair, nails, kind of palpating around on your face and stuff a little bit. I have my gloves on so that I can check, you know, make sure you're not having any problems with any swelling or anything like that, okay?
Is it gonna hurt?
No, it's not gonna hurt. I'm not gonna be sticking you with any needles or drawing blood or anything, so I won't be hurting you. Okay. I'm going to go ahead and provide privacy and stuff. I'm gonna raise the head of the bed up, bring you up on to my level. Kim, it is perfectly fine for you to be sitting on the side of the bed, but do me a favor, okay? Don't jump off the bed. Okay. So, Kim, I have a few questions for you. Can you tell me, when was the last time you were in the hospital?
February 28th.
Okay. And can you tell me what you had for dinner last night?
Yes. Went to Red Lobster and had stuffed flounder with crab meat. So.
That I heard you talking about that. Walking in, your appearance looks really great. You're dressed appropriately for the weather and everything like that. Your hair is nice and combed and not greasy, oily looking. I don't see anything jumping or anything like that. Your affect, your speech is nice, easy, fluent. You're responding to all of my questions. You're not displaying any jerky movements or anything like that. You're able to follow the content of our conversation. You're responding appropriately back with the answers and stuff. Also looking at you, everything looks symmetrical. I'm looking at your eyebrows, your eyelids. They're nice, long.
I'm about to put them on roll.
Oh no, they look awful nice. Looking at the symmetric shape of your head and everything is normal cephalic. Ears are proposed in a proper alignment and stuff like that. No deviation to the nose. Lips, nice, pink, moist. And I do not see any swollen areas or anything like that. When I touched your skin earlier, I felt how nice and warm it was. It's not moist, oily, or anything like that. Kim, I have another question. When you are getting in the car and stuff, what is one thing you always do when you first get in your car, vehicle?
When I get in my car, I adjust my mirror and put my seatbelt on.
Awesome, awesome. So do you always wear your seatbelt?
Yes, ma'am. My insurance won't pay if I have an accident.
That is true. That is true. Judgment is right there where it needs to be. Can you tell me the date for today?
May 25th, 2022.
And where are you at right now?
Marion University.
Okay. And why are you here today?
To do an assessment.
So,
I'm in the hospital. I had some stomach pain.
okay, so we've already addressed the J for judgment, the O for orientation, the M for memory, short and long term. We've already addressed the affect. We've already addressed the speech. So the other thing would be the cognition, which I'm going to hand you my pen light and to have you take it with your left hand, transfer it to your right hand, and hand it back to me. Perfect. So you were able to learn a new thing today. Awesome. I know. Okay, so the next thing I'm gonna do, I do have my gloves on and stuff, but I'm gonna have you take your fingers here and pull down your eyelid, bottom eyelid. I'm looking at the sclera, I'm looking at the conjunctiva. That's okay, you can let it go, thank you. It's white conjunctiva, no redness or anything like that. Gloves are on. I'm gonna palpate right up in here. Any pain, any discomfort, any soreness?
Nope.
Okay, gently palpate here, under here, any pain, tenderness? Okay, so we checked the frontal and the maximal sinuses, also looked at the lacrimal glands and tear ducts and stuff, and there's no redness, swelling around those areas. Okay, so I'm coming on both sides. You don't have to do it when you're doing the checkoff, but say that you're gonna address both sides. I'm looking at the shape of the ears. I'm checking the pinna. Is there any pain, soreness, or anything like that?
No.
Okay, and I'm gonna do it on both sides. I have my otoscope. I'm pulling the ear for the adult up and back. I'm looking in. I see the tympanic is pearly gray and everything, and the cone and light is reflected at 5 o'clock on the right. I'm coming over to the left, same situation with the otoscope. I'm looking in there. Tympanic membrane is pink and shiny, and the cone of light on the left ear is at 7 o'clock. I'm gonna come behind you. I'm gonna whisper a couple of words. And when I whisper a couple of words, I want you to take your finger to your left ear and tap right on that little piece there, okay? And I'm gonna say some words and you tell me what they are. Are you tapping?
I'm tapping.
Okay.
Cupcake coffee.
Uh-huh. And then I'll do it again over on the left ear. So she was able to hear me. That was cranial. Oh, I'm coming over.
Oh,
I
you're
was
just
just
saying.
saying.
Okay.
Yeah.
Okay. What can I say? Something. Did you guys see on your checkoff sheet that how she's going? You're following the checkoff sheet that she's going down. Okay. Just
Okay.
wanna make sure. Okay.
Okay. So that is also the acoustic nerve number 8. So we can start. I'm gonna finish up with the mouth and the nose and stuff.
Okay.
Going on through, as I'm checking her and stuff like that, I'm gonna be putting my hands up in her scalp. I'm gonna be feeling for any bumps, checking for any lesions or anything like that, and I'm gonna be checking for any vermin or lice, and there is none present.
Thank you.
Okay.
I'm so
So, I wouldn't be standing this close to you. Okay, so we've gone through the eyes and everything, covered all of that. Coming on down, I'm doing the nose, symmetrical to the face. There is no deviations noted. I'm gonna take my little pen light and I'm gonna have you tip your head up for me. Okay? And I'm gonna look in there and look on this side. Looks nice and moist in there. There's no drainage or anything like that. I'm gonna have you close your eyes, plug your one side of your nose, keep your eyes closed, and can you smell this?
Not really, but I have some of these issues.
Okay. Tell me it's alcohol.
It's alcohol.
Okay, okay, you can smell it. And go ahead and do the other one, checking on both sides of the nose and stuff. That is cranial nerve number 1, olfactory.
Okay.
Okay, so next I'm gonna have you hold this out for me.
Okay.
And let me know when you can read.
Well, I'm supposed to read the top line.
You can read it.
Because I can read the top line.
Okay.
95874. Don't ask about the rest of
Okay, that is cranial nerve number 2, and that is the optic nerve.
Okay.
Okay, so I'm gonna have you look straight ahead, Kim. Don't move your head, and I want you to follow my pen. Okay? I'm gonna move it in 6 different directions.
Okay.
Okay. Okay.
Okay.
I just checked your cranial nerves, making sure that everything's functioning, which assesses the eye muscles, and that was cranial nerve 3, 4, and 6, ocular motor, trochlear, and abducens. So everything functioned well with that. Next thing I'm going to have you do is open your jaw and close it and clench your teeth. That's cranial nerve number 5, and that's your trigeminal. I'm going to have you smile, frown.
Not a lot of frown.
Not a whole lot. Raise your eyebrows. Perfect.
I
Okay.
don't frown too
No
much.
Botox. No Botox for you, right?
No.
Okay, so we've got, that's cranial nerve number 7. That's your facial. So 7, 8. I'm gonna have you. I'm gonna be looking in your mouth now.
Okay.
I'm going for it. Just, I may have you open your mouth, stick out your tongue, and say ah.
Ah.
Okay. I could see your soft palate rise, your uvula rise, and so that's cranial nerves number 9 and 10, hypoglossal, and 10 is the vagus. Looking in there, I'm gonna have you raise your tongue again, looking underneath at the floor of the mouth. There's no redness, no swelling. I'm looking at the gums, no gingivitis, no bleeding, teeth dentation is intact, and I didn't see any restoration work or anything like that. So we've gotten that one. I'm now gonna have you kind of look, take and swallow for me. Okay? So when you swallow, I'm checking your trachea, and everything it moves up and down midline. So I'm gonna have you I'm gonna gently push over to the left, and I'm gonna palpate, checking for the thyroid. Again, shift over to the right, palpate the thyroid, and there's no swelling or any lumps noticed with that, okay? Next thing I'm gonna have you do is shrug your shoulders for me, okay? That's cranial nerve number 11, that's the spinal accessory, and that's intact.
Okay.
Last thing, stick out your tongue and say light, tight, dynamite.
I gotta say with my tongue out.
With your tongue out, with your tongue out.
Y'all got that? Light, tight, dynamite.
Tongue out. Light, tight, dynamite.
Dynamite.
Perfect, perfect. Cranial nerve number 12, and that's the hypoglossal. So we got done with the cranial nerves. We're done with the neural assessment. We're going to finish up with the rest of it still. And the next thing I'm going to check is all of your lymph nodes.
Okay.
So preauricular, postauricular, occipital. We're coming down to the posterior cervical chain. Coming forward a little bit here, and I'm going to the digastric, I just went blank. Okay, let me think about that. Digastric, okay. Coming on down, I'm doing the superior cervical. I'm checking the deep cervical chain. I'm doing submandibular, submental. I'm gonna kind of have you shrug your shoulders a little bit, checking in here for clavicular, supraclavicular. No swollen lymph nodes noted with those assessments. Okay? I think I got all of those. Next thing I'm gonna be checking, when I'm up here, I could check the carotid to see if there's any breweries or anything like that. Coming on down, I'm checking the skin bilaterally, also on the lower extremities. I'm looking for any signs of edema. I'm checking the temperature. It's warm. Temperature on all extremities is warm, equal. I'm looking at the capillary refill. Pinching the fingernails, I'll go down, check capillary refill. On the toes, everything responds in less than 2 seconds, so that's great to know that. I don't see any bruising. I don't see any lesions that I would need to worry about. Like I said, the skin's warm. I'm gonna do a little pinch here on you, checking the trigger, and it goes back. Elasticity returns immediately. I could check it up here too, and do a little pinch up here if I wanted to. But one area is all I need to do. Okay, so we've checked all of that. There's no edema. And do you have any pain or discomfort anywhere? No. So I'm going to be asking that just to be on the safe side. Looking back, nails. I'm going to have you take and put your nails together. I'm checking for any clubbing or anything like that. It goes like that.
I told you you don't have that.
Yeah. There you go. You got a diamond.
I got it?
Yeah. Bring it down a little bit. Perfect, you got a diamond. So nail bed, 160 degrees. And notice the cuticles look nice. She's not biting on her skin around the cuticles. And that is it.